The following is an example of how I use Dynamed Plus in my role as a clinical educator teaching residents in a continuity clinic. I was working with a resident who presented to me a case of an 8-week-old ex-28-week premature infant who had just recently been released from the NICU to follow up with us for routine care. As we discussed vaccination of the patient, I asked the resident if they thought that Synagis would be appropriate for this patient. The resident responded, "I think so, but I'm not really sure." So I said, "Let's be sure." And this is where I brought in Dynamed Plus. At that point, as you know, I always have the Dynamed Plus application or web page open and available, so it's there quickly. And I'm just going to put in the search term Synagis. I hit enter. I use this opportunity to discuss with the residents and to teach them about how Dynamed Plus is organized, because one might be tempted to click on the drug here. However, that's really not going to get us the answer that we want, and it's important for people to understand that Dynamed Plus is typically organized by its content by topic. So it's another opportunity for me to make sure the resident knows what this medication is for. So I ask, first of all, do you know what Synagis is for? And she appropriately replied, yes, the prevention of bronchiolitis or respiratory syncytial virus in infants. So I said, let's go to that topic. And in fact, if you look here, the way that it's organized is under prevention and screening, and it goes right to Synagis, which is also known as palivizumab. So we click into the topic, and I can point very quickly to where it goes to indications. And so we can see very quickly, and I say, look, here's your answer. Infants born less than 29 weeks, 0 days gestation for first RSV season starting at any time during the first 12 months of life. And then it gives a bunch of other indications. And we already know from our patient who was an ex-28-weeker that this is now an indicated medication. And from here I can then say, well, how do we give it? So from here, I can just scroll up, and there are the American Academy of Pediatrics recommendations for the dosing of Synagis. Here it's 15 milligrams per kilogram intramuscularly once monthly for the prevention during RSV season. And I can point out to the resident it's 5 doses, so now they know how to order it, how many doses they're going to need, and the answer was found quickly with reliable point-of-care evidence and guidelines, and the resident is now informed.